Hi everyone, this is the last lecture on the muscles of the shoulder region. We have covered anterior axioappendicular muscles and posterior axioappendicular muscles. So in this part, I will be covering the scapulohumeral muscles. So scapulohumeral muscles, as their name indicates, these muscles run from scapula to humerus. So there are 6 short muscles that run from scapula to humerus, and they mainly act on the shoulder joint or the glenohumeral joint. So these are deltoid, teres major, supraspinatus, infraspinatus, teres minor, and subscapularis muscles. So these 6 muscles, they originate from scapula and they are inserted into humerus and they act on the shoulder joint. So let's see the muscles one by one. Let's start with deltoid. So deltoid is named based on its shape. It's triangular or it's delta shaped. So it's shaped like inverted triangle. So that's why it's known as deltoid. And deltoid has 3 parts. It has anterior, middle, and posterior part. So as you see it here, it has anterior, middle, and posterior part. So first, let's see the origin of deltoid. So deltoid originates from the lateral third of clavicle, from the acromion process of the scapula, and from the spine of the scapula. So it wraps around the shoulder joint, and it originates from the clavicle, the lateral third of clavicle, from the acromion, and from the spine. So these are the 3 parts. So the part that originates from clavicle is the anterior part, or is known as clavicular part. The part that originates from the acromion forms the middle part, or is known as the acromion part. And the part that originates from the spine is known as spinal part, or the posterior part. And deltoid is inserted into the deltoid tuberosity of humerus. So in the shaft of humerus, there is a V-shaped rough area, which is known as deltoid tuberosity, and that's insertion site for deltoid. And deltoid is innervated by axillary nerve. So axillary nerve is a branch from brachial plexus. It's a branch from the posterior cord of brachial plexus, and it innervates deltoid. And when you see its action, the clavicular or the anterior part, it flexes the arm. The spinal or the posterior part, it extends the arm. But the middle or the acromial part, it abducts the arm. So the main action of deltoid is abduction. So when all the 3 fibers work together, they will abduct our arm. But deltoid, it cannot initiate abduction. So abduction, we'll see it later, is initiated by supraspinatus muscle. So the first 15 degrees of abduction is by the supraspinatus muscle. After that, deltoid will take over. And deltoid, it's a very thick and powerful muscle. In addition, deltoid acts as a shunt muscle. It prevents inferior displacement of humerus, especially when we are holding a heavy load in our hand. Deltoid holds the humerus in its position. It prevents inferior displacement. And deltoid is also a safe site for intramuscular injection. So in the upper limb, injections are commonly given at deltoid. It has a thick muscle fiber, so it's safe. We don't have any underlying neurovascular structures which are in danger. The other scapulohumeral muscle is teres major muscle. So teres major muscle, it's a rounded muscle, and it lies immediately above the latissimus dorsi muscle, and it's a synergist muscle for latissimus dorsi. So as you see it here, it runs from the inferior angle of scapula to humerus. And with latissimus dorsi muscle, it forms the posterior boundary of the axilla. So when you see its origin, it originates from the inferior angle of the scapula. And it's inserted into the intertubercular groove of humerus. So its insertion is near the insertion of latissimus dorsi muscle. So this is the insertion of latissimus dorsi. Just next to that, this is the insertion of the teres major muscle. So its action is adduction and medial rotation. So its action is similar with latissimus dorsi muscle, adduction and medial rotation. And it's innervated by lower subscapular nerve. So lower subscapular nerve is a branch from brachial plexus, from the posterior cord of brachial plexus, and it supplies the teres major muscle. So you can see it here, this is teres major. It lies above latissimus dorsi and below teres minor muscle. The remaining 4 scapulohumeral muscles, they are known as rotator cuff muscles. They surround the shoulder joint like a cuff, so they are known as rotator cuff muscles. So supraspinatus, infraspinatus, teres minor, and subscapularis, they are known as rotator cuff muscles. If you need an acronym, SITS, S-I-T-S, supraspinatus, infraspinatus, teres minor, and subscapularis. They surround the shoulder joint, and they are known as rotator cuff muscles. So the rotator cuff muscles, they stabilize the shoulder joint. As you see it here, they surround the shoulder joint anteriorly, superiorly, and posteriorly. So they support the shoulder joint on its anterior aspect, superior, and posterior aspect. But the inferior aspect of the shoulder joint is not supported by muscles. So this is the weak point. That's why inferior dislocations are common in the shoulder joint. So now let's see the rotator cuff muscles one by one. Let's start with the supraspinatus muscle. So supraspinatus, as the name indicates, supraspinatus, it lies in the supraspinous fossa. So it originates from the supraspinous fossa of scapula and is inserted into the greater tubercle of humerus. So as you see it here, it originates from the supraspinous fossa and is inserted into greater tubercle. So based on the orientation of fibers, when this muscle contracts, it initiates abduction. So the first 15 degrees of abduction are the functions of the supraspinatus muscle. And it's innervated by suprascapular nerve. So suprascapular nerve is a branch from brachial plexus. It's a supraclavicular branch, and it supplies this muscle. The other muscle is infraspinatus muscle. So at the name indicates, infraspinatus, it lies in the infraspinous fossa of the scapula. So as you see it here, this is the infraspinatus muscle. And it's partly covered by deltoid and trapezius, as you see it here. So this muscle originates from the infraspinous fossa and is inserted into greater tubercle of humerus. So this muscle runs on the posterior aspect of the shoulder joint. So when this muscle contracts, it will laterally rotate humerus. So its main action is lateral rotation of the humerus. In addition, since it surrounds the joint, it stabilizes the shoulder joint. And it's innervated by suprascapular nerve. So both supraspinatus and infraspinatus muscles, they are innervated by suprascapular nerve, and it's a branch from brachial plexus. The third muscle is teres minor muscle. So teres minor muscle, it's a rounded muscle, it's a small muscle, and it lies above teres major muscle, and it's continuous with the infraspinatus muscle. And commonly, it blends with the infraspinatus muscle. It fuses with the infraspinatus muscle. So it originates from the lateral border of the scapula, and it's also inserted into the greater tubercle of humerus. So this muscle also crosses the shoulder joint posteriorly. So when this muscle contracts, it will pull or it will rotate the scapula posteriorly, which is lateral rotation. So its action is lateral rotation. And in addition, it stabilizes the shoulder joint. And teres minor is innervated by axillary nerve. So deltoid and teres minor, they are innervated by axillary nerve. And axillary nerve is a branch from the posterior cord of brachial plexus. The last muscle is subscapularis muscle. So subscapularis muscle, it lies on the costal surface of the scapula. So it originates from the subscapular fossa, and it crosses the shoulder joint anteriorly. The other rotator cuff muscles, they cross the shoulder joint either superiorly or posteriorly. Supraspinatus, it crosses superiorly. The infraspinatus and teres minor, they cross posteriorly. But subscapularis, it crosses the shoulder joint anteriorly. So you can see it here. It lies just anterior to the shoulder joint. So it originates from the subscapular fossa and is inserted into lesser tubercle. All the other rotator cuff muscles, they are inserted into greater tubercle of humerus. But subscapularis, it's inserted into lesser tubercle. So since it crosses ventral to the joint, when this muscle contracts, it will rotate humerus medially. So its action is medial rotation. Infraspinatus and teres minor, their action is lateral rotation. But subscapularis, its action is medial rotation. In addition, like the other muscles, it stabilizes the shoulder joint. And it's innervated by upper and lower subscapular nerves. So these are branches from the posterior cord of brachial plexus. So that's all about the scapulohumeral muscles. So we have 6 short muscles. They run from scapula to humerus. So we have deltoid, we have teres major, and the remaining 4 muscles, they form the rotator cuff muscles. So they form a cuff around the shoulder joint, and they stabilize the shoulder joint. And these are supraspinatus, infraspinatus, teres minor, and subscapularis. So supraspinatus, its main action is abduction. It initiates the first 15 degrees of abduction. Infraspinatus and teres minor, their action is lateral rotation. And subscapularis, its action is medial rotation. So that's all about the scapulohumeral muscles.